Dr. Brennan, let's talk about glaucoma. Again, please tell us, really, what is it and how does it affect us? Not just what is it clinically and, what gets out of whack in the eye, but how do we now see the world or start seeing the world as we develop glaucoma?
Well, if glaucoma were left to develop, you would start to see the world as if you're in a tunnel. And you still have your central vision, but the peripheral vision starts to come in on you like a tunnel.
So that means I have glaucoma because my wife constantly keeps telling me I'm tunnel visioned.
Maybe you do. Have you had your eyes checked lately?
All right. So you kind of like start, I guess the way they put on horses, on race horses, so that they only see. But that's, of course, not good for us people in life. That affects driving, seeing the people on the side, I guess playing some sports and all that. It becomes obviously, I can see how that, how a tunnel vision, if you cannot see very, outside, that becomes a handicap. How does it go on? Does it go narrower and narrower till finally you don't see it all anymore, or what? How does it happen?
Well, if it's left untreated, it would get narrower and narrower until there's just a small island of probably 20/20 vision in the middle. I would imagine it's a little bit like looking through binoculars. If you have your full field of vision, you could see the cardinal in the tree, the flash of red. But you know how when you put the binoculars up, sometimes you cannot find it. So it's hard to find that sweet spot when you only have one little tiny sweet spot of vision.
Right. Well, you can't see anything except that little tiny thing. Okay. So and how can that be treated? I have heard somewhere that glaucoma is completely preventable if you treat it correctly and in time. Is that true? And if so, how?
Well, depends on how you think about it. It's somewhat true. In school, they taught us that glaucoma is like a slow march to blindness, and our job as clinicians is to find if the person has glaucoma and to treat it so that we can slow that march down to the point where they're going to die of old age before they get the effects of the glaucoma. So our goal in treatment is definitely to stop the blindness, but there are still people who do become blind from glaucoma.
And if that happens, it cannot be corrected.
If that happens, that's right. Glaucoma, let's say you wait, you're 30 and you don't get an exam until you're 45 because you have good vision and now you came in just because you needed a bifocal. Let's say that you started having glaucoma 5 years ago, and I found somewhat of a visual field loss. Some of that side vision is missing. We can't get that back. But what we can do is try to slow down so that more doesn't happen, or whatever happens next is going to happen in a very slow fashion.
I see. Is that done with surgery, medicine, with specific classes? How is it done?
Usually we start with eye drops. So drops placed on the eye, sometimes 1 time a day, depends on the type of medicine, sometimes more times a day. There are also surgeries available. So what tends to happen is the medicines work, we try a new medicine, and when we've gone through all our library of medicines, we consider surgery. And even surgery, they just do a little bit at a time because they want to leave always something else that we can do so we haven't run out of our options before the person is gone.
I see. Okay. I also have heard that, I think it is with glaucoma that I've heard that while it is a slow march to blindness, apparently some people fall over the edge literally overnight and they kind of wake up and go, holy cow, I don't see, or I see very, very, very badly, meaning it goes all of a sudden very fast. Is there some truth to that?
Well, there are 2 kinds of glaucoma. One is chronic open-angle glaucoma, and that's kind of the type I was describing. But there is an acute angle closure type of glaucoma. That kind of glaucoma, you're going to have severe pain in the eye, and you may be nauseous, and you're going to the emergency room because your eyes are just so painful. And so when we do a routine eye exam, we also check what's called the angle of the eye, the angle between your iris and the cornea. It's called the angle, and that's kind of where the fluid comes out and drains. And if that angle gets shut, it's like the drain being clogged, and if the fluid can't get out the normal route, the pressure in the eye builds too suddenly. The chronic open angle kind, the pressure just over time gradually sneaks a little bit higher, and the eye has time to get used to that, so it doesn't have the pain, but the nerves start to take the damage from that type. But the sudden spike in pressure, the eye doesn't have time to adapt, and the damage can occur right away. If you have severe pain in your eye, you need to get help right away, because if you do try to just take an aspirin and go to bed, the damage is occurring, and it's occurring suddenly.
Got it. All right. Okay, good. So I think that's about the glaucoma. I mean, so basically, again, if you find it early enough, you can start slowing it down so that, as you said, you die of very old age and haven't yet got blind. And that in itself, of course, is a good thing. All right. Wonderful.
Yeah, well, we look at the optic nerves in a routine eye exam, and if they look suspicious, like there's been damage to the nerve, then we can do things like a visual field test. It's a computerized test that you click if you see the light, and it's presented to you bright and dim, and we try to see how dim you can go before you can't see it anymore. We can compare that with other people your age to see if you're in the normal or if you're less than normal, and that helps us to know, too, if you're starting to have glaucoma. So there's lots of ways we can check for glaucoma. Pressures of the eye are important, too.
And once you do find it, you can do things to arrest it, the progress. You can't bring back the vision which was lost, but you can slow it down, the progress of it getting worse.
Exactly.
Again, glad we're having doctors out there. Thank you very much.